Hello everyone! Today we're going to talk about orthodontic treatment. Some people have straight teeth that line up together, but many of us have crooked teeth that don't fit together correctly. When the teeth don't meet correctly, this can put a strain on the muscles of the jaw, causing jaw and joint problems and sometimes headaches. The good news is you can easily straighten your teeth and correct your bite with the help of the right orthodontic treatment. Orthodontic treatment can help you to bite more evenly and reduce the strain. During this video, we will explain to you everything related to orthodontic treatment, such as the reasons for resorting to it, how it can be done, and the expected result after the procedure. Our role today is to answer most of your questions regarding orthodontic treatment. Today we have Dr. Lee, who is a leading doctor at Good Life Dental Hospital. He is going to discuss with us everything related to orthodontic treatment from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you will be updated with our new releases. Okay, so why is it necessary to have orthodontic treatment?
Actually, orthodontic treatments, the tooth relining procedure, is not necessary because this is for the aesthetic, because of the person's need. So it's not a duty, it's not a mandatory. So the reason that the patients want to get the orthodontic treatment, the 100% is because of the beauty. Mm-hmm. But there's a big gap between the patients and the dental specialist. So an orthodontic treatment is all about the patient's need. If sometimes they want to make their tooth aligned, sometimes they want to make their tooth not that aligned. In some trends in Japan, there's a high canal we call the aligned, it's not misaligned, mm-hmm. Tooth is cute. So sometimes the Japanese girl want to make their well-aligned tooth make some regular form for the orthodontic treatments. So this is all about the aesthetic needs. But we recommend, if you want to make your tooth beautiful, not because of the shape, but for aligned reason, we recommend make the whole orthodontic treatments, not only about the frontal tooth. Because the patients want to the appearance only. As the dental specialist, we want to the patients the back tooth in an unrevealed and hidden area is also the healthy, also to make the good function and good support for the anterior tooth. There is some reason that your anterior tooth get misaligned because it's not about the anterior tooth, it's about the whole tooth area. So if you just correct the certain area, then the relapse, it's also the complications of the orthodontic treatments, the relapse or the things can be happen if you're not touched for the back tooth. So the basic needs for the people who wants to get the orthodontic treatments is to make the tooth is a beautiful and aligned, but for your health and the future, to make the back tooth is also the concern about the orthodontic needs. Not only about the aesthetic, but also the functions and the longevity for the treatments. And so sometimes the people ask me about the periods of the orthodontic treatments. Can you make the shorter but it takes 2 or 3 years. It's really long. So can you make it shorter, like 1 or 2 months? Or how about the advanced life edge technology? What about it? And sometimes they want to hide the device we call the bracket, to hide the bracket inside the tooth, or even the invisible, such as the Invisalign or the things like that. Mm-hmm. The transparent orthodontic device. Yeah. There's a lot of things. It's also recently invented in China. Yeah. But you have to know that there is a limitations for the inside. We call the lingual bracket and Invisalign, the transparent orthodontic device. It's all limitations. So you have to choose the rightful device, and you have to get some good orthodontic treatments.
So which kind of orthodontic bracket or treatment is better in your opinions?
There is a lot of bracket system in the device, the orthodontic device in this area. The basic bracket is made by metal. It's metal. The metal bracket is actually quite good because the orthodontic treatments actually we need a friction. The basic principle about the orthodontic treatments is the control the friction to make the tooth moving. So the metal bracket is the best way to control the friction, but it's really not beautiful. So nowadays we using for the ceramic bracket for the control the friction. However, the most popular orthodontic bracket in Korea and the worldwide is not about the ceramic bracket. However, the ceramic bracket is not the popular one. In certain this area, in certain this time of high technology, we using the Clippy C or the Clippy M or the Clippy L invented by the Tommy in the Japan, and the Damon Clear or Damon bracket and invented in Omco in the United States. We call that kind of bracket is self-ligated bracket, which is not using the wire or the rubber link to fix the wire. Just inside the bracket, there's some kind of ligated is holding the wire, the function. That's also the kind of the device or invention for the controlling the friction. And sometimes the patient wants to hide their orthodontic device for like the MC or the public speakers or celebrities. So in that case, they're using the inside the bracket. We call the lingual bracket. It's famous for the 3M incognito or etc. But you have to know that the bracket for the outside, we call the bulkhead area, the outside the bracket like a Clippy C or the Clippy M, and inside the bracket like a Clippy L or the incognito, is really hard to control the precise tooth moving procedure, especially in the inside the bracket. It's like if you just put your arms like this and moving this is easy. It's about the bulkhead area, the outside the bracket. But the inside is like this, just moving this little arm to make the things. So it's really it's not easy, and it takes more time if you get the inside the bracket. And today, a lot of aesthetic demands, even though the orthodontic treatments, so the patients want to transparent orthodontic device, such as the Invisalign or the Angers in China, and the other etc. things. But you have to know that
if we only press on the crown area, it can tilt and fall. Thus, we need a force on the root as well, in order to avoid tilting. That way, with concurrent pressure on the root area as well, the tooth can move without tilting like this.
We call that the bodily movement, and this pushing is just the tilting. So for the longevity for the dental orthodontic treatments, we have to consider the bodily movement, not the tilting movements. So all the brackets like metal or ceramic, the Clippy C or the incognito has all that kind of mechanism inside the bracket. But in nowadays, the patient wants to even not attach that bracket. Transparent orthodontic device is invented, but the transparent orthodontic device only can make that tilting movement, but bodily movement yet. So the mimic, to form that bodily movement force, you have to attach in the front or inside a lot of attachments for the resin restoration. So if you see the patients who get some transparent orthodontic device, such as Invisalign, the surface of the frontal tooth is uneven, like with a lot of attachments, and the resin restoration, resin filling is scattered. It's not beautiful, actually. And the transparent tooth orthodontic device have limitations. So you have to choose your orthodontic dentist carefully because there is no perfect system or no perfect brackets or procedures. So sometimes you just need a minor correction, but sometimes you need a heavy correction for the lot of the bodily movements and the things. Sometimes you have to choose your aesthetic reason for the height the bracket inside, sometimes to transparent the orthodontic device. So the dentist knew that kind of limitations and do sometimes make a good recommendation to the patients. So back to the question, to which orthodontic bracket, orthodontic system is better, I have no idea, but I highly recommend to the test the outside for for the good result for the orthodontic treatments. Please please wait for 2 years for your healthy, aesthetic, beautiful 20 years.
So can you tell us, is there any complications while doing orthodontic treatments?
Actually, there is a way more complications regarding orthodontic treatments is about the tooth moving. But think about the tooth. There is a nerve is inside the tooth, and there's the tooth is surrounded by the bone. If the dentist push the tooth too hard, then sometimes the natural tooth, the root tip of the natural tooth is gone. So after 2 or 3 years later, the tooth is really short. Sometimes the nerve inside is just that. So after 2 or 3 years later, one or two of your frontal tooth get black and black. In that case, the nerve is dying. Nerve is dying because of the orthodontic treatment. But the root resorption and the nerve dying is not serious complications. If you received the orthodontic treatments for untrained and not that good dentist, sometimes your jaw is like your jaw. There's a joint is in here. If you're moving the tooth is unwanted and unhealthy way, sometimes you get a osteoarthritis. Osteoarthritis is it's about the olders, right? But if you receive a wrong orthodontic treatment, sometimes it can happen in the teenagers or early 20s. So the orthodontic treatments is about the tooth moving. So there's a complications for the root resorption, and sometimes the tooth is dead. And the major complications about the not good orthodontic treatments is for the jaw resorption and the osteoarthritis.
Okay, thank you so much, Dr. Lee, for visiting us and answer our questions today.
Thank you.
Thank you so much.
Thank you.
Today, we learned many things about orthodontic treatment, and the doctor explained in details everything related to this dental procedure and when to resort to it. Thank you for joining us today once again at Cloudsville TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.